When you look at a plate for a person with this condition, the FCS, most of the food has to come from the plant kingdom, the vegetables, lots of different colored vegetables. A portion of protein, but very lean protein. It could be in the form of fish or shrimp or just some little chicken breast. You could also use some complex carbohydrates like beans, anything whole grain, and so that could fill the plate. And the dairy could be non-fat, could be skim milk, could be non-fat yogurt, and there could always be a piece of fruit along with it. There is an oil that they can use, and that's called MCT oil, which is medium chain triglycerides, and it's a medical food, and it's made by one company, Nestle. These medium chain triglycerides have fatty acids of chain lengths of 8 and 10, and so these are medium chain, and patients have to be very careful that they don't use coconut oil, because there's a lot of confusion on the internet stating that coconut oil is rich in medium chain triglycerides, and of course coconut oil is a lot cheaper than buying this medical food called MCT oil, because the medium chain in coconut oil is lauric acid, and it is 45% of coconut oil, and which is atherogenic, which raises LDL cholesterol, and it's really bad for them. It's bad for all of us. So we shouldn't be consuming a coconut oil, but we can buy the fractionated coconut oil that's rich in the two fatty acids, the C8 and the C10. And this can be obtained through insurance companies as well. So the doctor has to write a prescription and speak to the insurance company if needed, and explain to the doctor and the insurance company why this patient needs this MCT oil. Well, I am very fortunate that I work in an area where we have a lipidologist, Henry Ginsberg, who refers patients to me. And we get these very difficult patients. Sometimes I have had patients who have FCS, who have diabetes, and who are pregnant. So you have to make sure you're giving them all the nutrients they need, because it's for them and for the baby. But I have heard from colleagues that patients go to several doctors. You know, they start with the internist and finally through an endocrinologist or a gastroenterologist, and they get lucky to see a lipidologist who is familiar with this condition.